Okay. Welcome to this Parent Carer webinar around the Neurodevelopmental Service and an update for Warwickshire. And we have a couple of our colleagues with us today. We've got Gemma Cartwright and Maria Dainter. So if we just pop onto the next slide. So we've also got colleagues from Warwickshire Parent Carer Voice, who are the Parent Carer Forum for Warwickshire. Avril hopefully is here somewhere, but there's so many people in the room, it's very difficult to tell. But just to explain so my name is Sam Craven, and my role within Warwickshire County Council is really about the voices of children, young people and parent carers. So it's the work that my team do to make sure that young people have a voice, that parent carers have a voice, which is why we work so closely with our Parent Carer Forum. And we want to, Avril says she's here, welcome Avril. We want to make sure that actually the voices of children, young people and families are heard and have an influence within the work and the change that's needed across the county. And there's been lots of work being carried out across Coventry and Warwickshire in terms of the Neurodevelopmental Pathway. So I'm going to hand over to Gemma, and Gemma, if you can introduce yourself and take it away.
Well, thanks very much, Sam. It's really amazing to see how many people are here. I'm very surprised, but welcome to everybody. Some of you may recognise me. I have previously been the service manager for the All-Age Neurodevelopmental Services for Coventry and Warwickshire Partnership Trust. If you would just like to turn your camera off if you're a late arrival, just because this is being recorded. Okay. I've actually got my colleague Jo Ranger, who's in the audience today, so she's with us, who is the interim service manager as well. So she'll be happy to take some questions with me at the end. But the reason why I've introduced Jo is because I've stepped into a new post as well, assistant clinical lead for neurodiversity. It sounds very grand, but basically that is just overseeing the autism strategy. Hopefully you've all heard about the autism strategy for Coventry and Warwickshire, but I'm going to talk a little bit more about it because I think it's really important for you to understand the whole context, because the neurodevelopmental team can't exist without the system working around it. And whilst the focus has been on waiting times, and I'm going to talk about that, it is really important that we understand of all the amazing work that's happening and how much the Coventry and Warwickshire Parent Carer Voices are all coming part and contributing to that. Okay, can I have the next slide, please? If you are coming late, could you just make sure you don't have your cameras off on even, so because it's been recorded, just for your anonymity. So in terms of the autism strategy, hopefully you're aware there is a national autism strategy, but there's also a local Coventry and Warwickshire all-age autism strategy. It's been going on for over a year now, well over a year, into our second year, and integral to that is our Parent Carer Voices and our Experts by Experience. There are 5 work streams or 5 priority areas that we're covering, and I just wanted to give you a brief update on some of those areas, just so you can get a bit of a context of some of the things that are happening. As I said, we can't do this in isolation from a health perspective, and autism is absolutely everybody's business, as hopefully you're all aware of. So the first priority that we have is around supporting people with communication, sensory and emotional needs to help themselves pre and post assessment. This has been a particularly busy work stream and priority. Lots of activity. We're in actually face-to-face last Friday, which was really exciting, with our parent carers and our Experts by Experience. Some of the work that we've produced from that work stream include the information and advice leaflet for neurodivergent individuals and their parent and carers and their families. I will put in a link in the chat once I've stopped speaking later. This is a really helpful guide to what's out there nationally and locally, and we're also about to produce a more easy read version and a printable version for you all as well. So hopefully you're all aware of that, because it is a really great resource that was co-produced. So our parent carers and Experts by Experience help us to produce that leaflet. Linked to that as well It will be in the chat. I'll make sure it's in the chat for you. Linked to that is the dimensions. Hopefully, again, you're all aware of the dimensions of health and wellbeing. It's an online tool. It's on the website. It's about helping you to identify your own and your child's young person's strengths and any support needs they may have, and what's around in the community, and also some self-help such as apps and videos and resources. We are very aware that there are some, some improvements we can make in the dimensions. So again, we are working with our experts by experience, and we are reaching out to our community and asking people what it is we can do differently. Have we got the dimensions correct? Are there more that we need to be introducing? Is the report that comes out helpful? And what I will be doing is putting in a survey link into the chat when I finish, because I'd really welcome as much input into that as possible, because we need to make sure that this is a tool that is accessible and helpful for our neurodivergent families and individuals. So please do fill in that survey for us. The more information, the better. As part of this as well, we've just reviewed our frequently asked questions. That's going out now every time we have a referral and acknowledgement letters sent out, but it's all also on our RISE website. The main focus of the frequently asked questions this time in the revised version was around helping people to navigate and to understand what to do if you were going to seek a private assessment for autism specifically. Hopefully it will provide a little bit more guidance for you. I can't advise you which services to go to, but I can give you a bit of support in terms of helping you to make those decisions of who to choose, how to choose it, and what you're looking for in terms of an autism assessment, and some of the questions you can be asking, a little bit of reassurance. The second priority is around reducing inequalities, and I'm sure, as you will be fully aware, there are many inequalities that our neurodivergent population face. We're focusing on a lot of the wider determinants of health, as we call them. That's including housing and employment and education. We've been looking at some of the referral information and who are referring in, which schools are referring in, which schools aren't referring in, who are accessing this like specialist teachers services and the training that's available, and are we reaching all of our community? Are there some different groups that we're not able to access or not able to access us? As part of that as well, we're looking at we have our emotionally based school avoidance project. Whilst it doesn't sit within the autism strategy, I do attend that project group, because I need to make sure that that voice is in there and that our autistic children and young people are included in any of the considerations of that project going forward. Priority 3 is around making sure our local organisations have the skills to support autistic people. You may have heard about the Oliver McGowan training. This is a mandated training. Well, will be very soon. It will, once it's rolled out for health and social care workforce. It's going to be a really important turning point in ensuring that our professionals in those areas have that understanding of the autistic children and young people, and to actually consider how services are provided for them. This isn't only about Oliver McGowan, it's way broader than that. We're currently mapping out all of the training that's provided across the system. Priority 5 is co-production. Co-production goes through is a thread through all of these priority work streams. I really hope that is reflected in some of the information you're hearing and some of the work that's happening. Obviously, you have the Working Together Charter in Warwickshire, which is brilliant framework that the Warwickshire Parent Carer Voice have provided, and have the Impact team of service as well, which is our children and young people's voices. Really keen to make sure that's continued. We need to hear what's happening on the ground to ensure that what we do in services is meeting the needs of our families. We also have within the strategy have a contract, an agreement with Grapevine, and that allows us to have access to our adult experts by experience. And again, they sit in a lot of and they co-chair a lot of our priority work streams, as well as our Autism Partnership Board, which is across Coventry at Warwickshire. Next slide, please. Priority 4, it's a little bit more complicated, but this one's about developing an all-age autism specialist offer. We recognise there are gaps. We haven't got it right yet. We're on a journey, and we're all on a journey together, but we recognise that there is possibly a need for more of a specialist autism offer, particularly when you have a diagnostic service that really has been focused very much on that diagnostic part. But part of this was around redesigning our diagnostic pathway to reduce the length of wait. It was recognised that the length of wait for an autism assessment was just unacceptable. And we have had a lot of investment and a lot of attention paid to this area, which has been really positive. And we have worked with a number of partners to try and mobilise more additional capacity for our assessments. We've also started to work on building a capacity for assessments across the system, so it doesn't have to always just fall into a specialist neurodevelopmental service. But we have to do this carefully, and we have to make sure that anybody that does have an assessment outside of a specialist service is receiving an assessment that is compliant with the NICE guidance and the newly commissioned guidelines for commissioners as well. We need to make sure it's evidence-based and that the professionals who are doing the diagnosis are trained sufficiently to be able to do this, and that you have received a report at the end that is helpful to the child and the young people and the families. So we've done some work already with our educational psychology colleagues and our specialist teacher colleagues across Coventry and Warwickshire, and we're about to extend into our RISE services, so working with specialist mental health and paediatrics to see if we can support some of the diagnostics to happen whilst the child is open to those services. The aim to reduce the replication of information, repeatedly telling the stories, and ensuring the children and young people have got their needs met in the most appropriate service and not having to be bounced around to different services to get different assessments. Also, we're doing a lot of service system-wide workshops. What we want to do in working with Warwickshire Parent Carer Voice and also Grapevine to have real life stories about the journeys that some of you have been on as families and children and young people. What was it that you were hoping for? What was it the support you needed? Where were the gaps? What were the expectations, and what did the services provide and what didn't they provide? What were the barriers that you were facing? And that's been really helpful for us to start to unpick where the gaps are in services. Is that a gap that we need to address from education, health and social care, the third sector, or is it something that a specialist neurodevelopmental team could start to think about filling with the right investment? So we're not there yet, but it's a journey, as I say, that we're trying to really understand what the needs are, but obviously it cuts across all of the system, not just a health need. We want to make sure that our services, particularly in health at least, have got professionals that can make adjustments and that these services are accessible for our children and young people. We have a clinical offer that's trust-wide within Coventry and Warwickshire Partnership Trust. It has sponsorship from our executives as well, and our chief exec is fully aware of it. It's making sure that autistic children and young people have a better experience of our services, including physical health and mental health services, and they can access that support when they need. So as part of that, we have developed something called the 4Ps framework. This is just helping people to think differently about what we call reasonable adjustments. So thinking about the child and the young person, thinking about some of the processes that can be barriers, some of the how you work in partnership with the child and young person, the family as a professional, and some of the places we expect our children and young people to be in, to be seen in, and if they're actually okay, they're too bright, too loud, etc. So there's a lot of work being done in the trust to try and ensure that our children and young people have better experiences of health services. One of the things that's really key to this is training, and actually the RISE service, which, as you're probably aware, consists of all our emotional wellbeing and mental health services across Coventry and Warwickshire for children and young people. One of their key targets is to ensure that all 95% of their staff have had training in autism. And this isn't just a one-off training, this is 8 modules that we created as a specialist neuro team to really help their staff to understand the differences and the vulnerabilities around mental health for autistic children and adults. And it's really exciting that, you know, feels like there's a real momentum there. The other part of it, as I've mentioned, is trying to unpick what it is a specialist neurodevelopmental service could look like in terms of post-diagnostic support. We piloted, or we're trialling, we had a complex case panel, not really liking the name of that, but it was just a way of trying to understand some of the children, young people that often are sitting in a number of different services, and how we can do that better. What is it that there's the need there? And what we're starting to realise is that a specialist neurodevelopmental team is really needed to be able to provide consultation, joint working, so all the other services that support children and young people. And often some of these children may need some more understanding of their neurodivergence. So particularly if they have multiple diagnoses such as autism, ADHD, dyspraxia, etc., and how, excuse me, as a neurodevelopmental service, we may be able to start to help families and the young person to understand their neurodivergence and understand the support needs that they may have when they go into education, into healthcare, etc. So it's, again, work in progress. We're not there yet. So I just wanted to share a couple of stories and some of the messages we've heard, which is kind of why we want to move forward. So, for example, previously or currently, we hear families or children saying, I'm a child, I'm looked after, and I've been referred into mental health services as I'm really anxious. My referral also questions if I'm autistic, but I've been told I will need to go to 2 different services for both things. What we're hoping, our ambition and what we're working towards is a new narrative on that, and that it will be, actually, I'm a child who is looked after. I have anxiety and I may also be autistic. My anxiety is the main problem for me at the moment. So my mental health worker has suggested that they see me with a neurodevelopmental clinician. They do a joint assessment and for both my anxiety and the autism. So it just shows that there's a potential change in how we're going to work forward. So we're not having to tell our stories time and time again. And that child and young person doesn't have to get to know a whole new clinician in a different environment. Next slide, please. Another story. I'm an autistic young person who's struggling and I'm at crisis point. I've been told that I don't have a mental health need, so I have no service to go to. This is something I've heard quite a number of times. Our understanding of mental health is very different, has changed over years, but we actually still have mental health services that are very much around diagnosable mental health needs, clinical levels of anxiety, clinical levels of depression. And whilst we absolutely know our autistic children are more vulnerable to that, we also know they experience levels of anxiety which aren't necessarily at a clinical level or diagnosable level as a different diagnosis. So what we're hoping going forward is that we will hear something different, and we will hear, I'm an autistic young person who's struggling and I'm at crisis point. I don't have a mental health need. So instead, I'm going to be seen by a specialist neuro community team. Wouldn't that be great? So again, recognising that you can have a crisis without having a mental health need. And actually, some of these children, young people don't want to be in a mental health service because they recognise they're autistic, not mentally ill. So it's about how we maybe shift some of the resources and really think about what we're offering. Next slide, please. This is a really complex, busy slide, and I apologise, but it's trying to help us to understand what the vision is for this specialist community neurodevelopmental team, really about right service at the right time. So if a child has mental health needs, they sit in a mental health service, but what they can do is access support from a neurodevelopmental service to ensure that there is some adjustments in place, that if they're having therapy, that it's adjusted and it's meeting their needs, that we can provide training and support for these different services. But actually, if there are no other health needs and they need to sit in a neurodevelopmental service, that we'll have the capacity or the ability to hold some of these children as well. So it really is about bringing that expertise and sharing that expertise as well across some of the system, because at the moment it feels like we're in a little island on our own and not necessarily working together, mainly because of capacity to be able to do that. So we just want to increase some of the confidence in the system around understanding neurodiversity, specifically around autism as well. Next slide, please. So I just wanted to quickly run through, I mean, as I say, we're on a journey. We haven't got there. This isn't at the end by any means, and we've got a long way to go. But I wanted to celebrate some of the successes that we have had and recognise the work that's been needed, and some of the patience that we've had in terms of the patience from the families in terms of bearing with us, helping us with some of our processes around our DNAs and our closure, so do not attend or did not attend, and closure processes, helping us on the journey to get as right as we can. So we've delivered 4,120 autism assessments. This was at the end of May, against a planned target of 3,251. That's a lot of children. We have reduced the overall waiting time from 5 years down to less than a year. We recognise there are still children and young people waiting more than a year, but we have contacted everybody that has been referred in up to that year point to ask for more information or to get them ready for that assessment. There are some people waiting, as I said, because we haven't got information back, or they haven't been able to attend their appointment. So, but we are contacting people who've been referred within 8 to 48 weeks. We've mobilised 9 different partners. Some of you may have experienced some of the assessments with these partners. We have a very robust reassurance process with them. We meet with them every week. They had to complete a very detailed framework for assurance. We check reports. We're as confident as we can that we're getting a good service from these partners as well. We've got a number of system-wide workshops, as I talked about, with education, social care and health, all as well as our experts by experience, really coming together to understand what the gaps are, because, as I said, an autism diagnosis is just one part of the puzzle, and part of the process for you as families and the children and young people. So we need to make sure the system is helpful for you all. We've looked at our services already. We've got a green light toolkit. It may not mean anything to you, but it's a way of a service assessing itself against a criteria to see how are we doing around our adjustments for autistic people. Could we do better? Which is where some of the work is coming out around reasonable adjustment toolkits. So we're just about to develop one. We've got one developed for adults. So professionals working in adult mental health services, they now have a toolkit to use to make reasonable adjustments for autistic people, and we are about to develop one for children and young people. So if you're interested in being part of that, drop me a line, because I'm really keen to obviously have our parent and carer voices and our children voices as part of that toolkit, so that professionals working in children and young people mental health services know what the reasonable adjustments that they can provide. Okay, next slide. This is just the 4 Ps model. I won't go through it. It's just really to, instead of a tick box of these are the reasonable adjustments that children and young people need or adults need, it's just getting people to think differently. So think about that child, that person at the centre, find out what it is that would help them, think about our processes, how we work in partnership with them, and the places that we're seeing these individuals. And that's all really important when it comes to particularly around autistic people. Next slide, please. So I've talked an awful lot about autism, and we are a neurodevelopmental service. I was always very determined to call it a neurodevelopmental service, because we know that what we call the co-occurrence of ADHD is really high for autistic people. What has happened, there's been very much a national attention on autism, hence why there's a national autism strategy and there's a local autism strategy. There has been less national attention on ADHD, even though the prevalence for ADHD is far higher potentially than autism. What we have found by doing more autism assessments is we've recognised that children also present with ADHD, and that has had a consequence. We now have an increased waiting list for ADHD. This isn't great. This isn't an ideal position to be in, and we know this is causing a lot of concern for families. What we're trying to understand now is what is the demand for these assessments, because currently there is no additional investment from a national perspective. We are not on our own. This is a countrywide concern. The increase for ADHD referrals has significantly increased across the country. So we're hoping it's just a matter of time before NHS England start to consider what it would take to address this need. Locally, what we are doing, we've revised our pathway. We've working with our psychiatrists to try and streamline, to try and make it more efficient and lean, really, in terms of how we can move things forward. We have had a period where ADHD was actually put on pause during COVID because our psychiatrists were dealing with children who were significantly in crisis. So we have some catching up to do because of that. But it's not underestimating or not recognising the significance of ADHD and the need for these children to get the support that they deserve. We're also looking at a frequently asked questions specifically for ADHD, because we recognise some parent carers want to go private, and what does that mean? So there's some information we're going to need to provide about if you're going to go private, what that means in terms of then coming back into the NHS. And unfortunately, autism and ADHD are commissioned separately. But as I say, the ambition and the hope is that that is brought together, and it is, you come into a neurodevelopmental service and you will be seen for both things once we get the balance right in terms of how we, the capacity and the resource to be able to deal with that, the demand that's coming through the door. Next slide, please. So there's some contact details. It's a really good idea to email if you want to contact us. We respond to emails a lot better than we do to voice or telephone calls. But if you phone us, you leave a voicemail, we'll come back to you. We have a really lovely neuro admin hub that can contact you back. It won't be immediately, because we, as you imagine, we have a lot of information flowing through that team. But hopefully you will get an answer. I will put in, as I say, I hope, I'm not sure what's put in the chat, but there's the information advice, the dimensions link I'll put in there. There's also the survey around the dimensions I will put in because I want your feedback, and I can also put in the link for the frequently asked questions as well. So hopefully that will give you some information. So thank you so much for listening. I'll look forward to your questions at the end, and I'm just going to hand over to Maria now. Thank you.
My name's Maria Dainter. I'm the service manager for autism services at Coventry and Warwickshire Mind. So I started off a couple of years ago, and we set up the specialist key worker team, which some of you may have heard of. It's around avoiding hospital admission for autistic individuals up to the age of 25, or if they are in hospital, ensuring that their sensory and other needs are met. And recently I have had the privilege of taking over the CAS service. But what I wanted to say is, actually, I have the very great privilege of having a 22-year-old autistic son, and I think that is probably the best learning I could have ever had for this job. My background is in education. So if we could go on to the next slide, please. Okay. So you probably will have heard about CAS before. It's been around for about 4 years, and it used to be in 2 separate teams, a children's team and an adult team, and it tried very hard. Obviously, there was the COVID period, but it wasn't quite hitting the spot. There were some pockets of brilliance like Trisha's toolboxes, and anybody who's ever had the good fortune to be on one of those knows how amazing they are. But there was actually quite a few things that we just weren't getting right. And so when we wrote the bid for renewing the CAS contract, we knew we needed more. And I came on board at that point, and also we were reaching out to local organisations. And as a lived experience person myself, I was very keen that anybody we joined in with should have that authenticity to them. And so, and one of the areas that we quite rightly said was that it's really hard to know where to go. It's so confusing, and you've got to go here for this, here for that, and it just makes your head hurt. And we had so many calls through to reception from people who hadn't been referred into our service just because they knew we did something about autism. So actually, we decided that the navigation part needed to be the absolute forefront, and everybody should come through one front door. So if you want to get hold of any of our services or just some advice, there is a phone number on there, which is Monday to Friday, 8 till 8 p.m. There is also a website where you can get various pieces of information. That's a work in progress. We're hoping to put a lot of our videos and things on there. And I'm trying to persuade Trisha to record toolboxes as well, even though it's not the same as being live. Sometimes it's just nice to dip into those sessions. And we're also going to add a lot more resources. There's also an email way that you can contact them. And the reason that we decided to link in with Autism West Midlands is that every single member of their helpline has lived experience. They are either autistic themselves or they have children who are, and now probably grown like mine, were. And when you ring the helpline, you can ring it for all sorts of reasons. Sometimes you just need to speak to somebody who gets it without having to try and explain it, and they do. And so sometimes you might just need to have somebody that actually can just go, it's all right. And Autism West Midlands have said they have several frequent callers who call at the same time every week because they know a certain person is on, and just to have that friendly catch up. But as well as that, they can also offer you advice because they're very well trained and they have lots of links. And they can also refer you on. And the referring on part brings in us, and also it brings in Act for Autism. Anybody who's been on an Act for Autism will have been on the Tessa roller coaster, and that's an amazing ride. She's a wonderful presenter and facilitator, and she too has lived experience and speaks with that authenticity. Now, to be able to access CAS, you have to be a Warwickshire or Coventry resident, and that basically means as well that your GP should be in Warwickshire or Coventry. Okay, so moving on, we've just talked a little bit about the navigation part. So if you come through the navigation hub, then you will be through to, in the first instance, Coventry and Warwickshire Mind after Autism West Midlands. And from there, you won't have to do that awful thing where you're through to somebody else now, so you've got to go through it all again. We use the same information portal as Autism West Midlands, so everything that you've told them we'll have access to. And we'll then look at, actually straight away, we can offer you the toolboxes from Trisha. And they run on a Tuesday evening and a Thursday afternoon. We recognised that there weren't so many people from the north of the county attending the virtual ones. So these will be run in person from Nuneaton as well as live in the next, probably by the mid-July, I think they should be running in Nuneaton as well as online. So there's the training element of it. Tricia and I hate the word training because as a parent myself, I'm just sick of people telling me I need training like it's my fault for not understanding. And that's wrong. What you need is tools to know how to cope, how to do things, what to do next. So I probably would change training if I could, but that's what it was called. I'm over a lot of the community outreach offer. So one of the other things we can offer almost straight away are our groups. So we run groups across the city and county for children and adults. And we're certainly looking at extending the adult ones because some of the feedback I've received is that actually it would be great if some of them ran in the evenings because a lot of us are at work and that's fair enough. With the community outreach program, it's basically a sort of education service, but I will come on to our service offer in just a moment. We are also setting up a really exciting part of this, which is around peer mentoring, which Mind are hosting. And that will be with me, an amazing lady called Paige and another lady called Millie, and really to try to get that peer-to-peer support going. Could I have the next slide, please? So these are the aims of our service. As I mentioned, we're not clinical. We will help people understand, and I always put it quite simply as this: we have 4 informal I statements that we want people to say that they can score higher on when they leave us than when they entered. So the first is I feel happy. The second is I feel safe. The third is I feel like I belong. And the fourth is I know what to do if I don't feel happy, safe, or that I belong. And those groups in particular are an amazing space for not feeling other. And I don't think we can ever overestimate how that is. We also run special groups for young people in the transition stage. And what I'm looking at doing now that CAS is an all-age service is looking at the ages of the groups so that there's some overlap, because we absolutely appreciate that it's stage, not age. And so while we would never have an adult in with 8-year-olds, for instance, there can be little bits of overlap. So it's really our job is to help you to know that what you're feeling is okay, to help not only you understand your autism, but the people around you, because actually you probably know exactly what you feel like and you just need help to understand how to explain that to others. We also support with emotional regulation, and particularly with schools and workplaces, about reasonable adjustments that can be made. Typically our outreach offer is small scale groups, because the power, and they're only at the maximum number is 4, it's usually 3. The power of sitting in, of being with other people of the same kind of age is that you don't feel different, because that's the last thing any of us ever want to feel. We want to know that we belong in this society, and actually there is a very good place for us. If I could just go on to our last slide, please. So this is our service offer. As I mentioned, Autism West Midlands are running our navigation front door. We then got the community outreach service, which is all age, small scale groups, one-to-ones, and also youth groups and adult support groups. And we're setting up our peer mentor support service currently, and we have the training and education which is provided by Tricia and by Autism West Midlands and by the rest of the team. Now, the one question I know I'm going to be asked is about the wait time. And what I can say to you is, under the new CAS partnership, we have been very lucky to have increased funding, which has meant that we have been able to employ more people, because the CAS team of old were absolutely doing their best, but there weren't enough of them. What we needed was a cloning machine, because demand, as I'm sure you know, far outstrips supply. And thank goodness other services are now coming on board, because it was beginning to feel like perhaps CAS was the only autism service out there at one point. But I know that isn't the case, and Gemma certainly put us right on that one. What I'm looking at doing is making it work better. We've just about come to the end of the training program with the new people, and so currently, I will be honest with you, and I will say the wait time varies depending on what you want. If you want youth groups and toolboxes, it's straight away. If you want small scale groups, it's probably likely to be within 6 months, which I know still feels too long. If it's one-to-one, it will be longer. And I'm trying to make it as streamlined as I can, while still meeting the needs and listening to people. What I would really, really like, and I'll put my email in the chat, is if you could share any experiences or any thoughts on how we can make this service what we really need it to be, because I know we're not there yet. I know, absolutely know we're not there yet, but we will be. And with your help and co-production, I would really, really value that. So I'm going to stop now and write it in the chat.
Thank you, Maria and Gemma. We have had a lot of questions, and I'm conscious that time is ticking away. These things always take longer than one anticipates. Just to kind of offer some kind of reassurance, all of the questions that have been asked in the chat, we will respond to. We won't be able to respond to all of them in the time that we've got left, and I'm aware that you know you'll have places that you need to go as well. But we will document that down into a question and answer document and share that along with the recording of this webinar. I'm going to stop the recording now.